Nearly 20 years before man landed on the moon, an equally important event happened in a little town called Framingham. Perhaps it has left a more profound effect on the way we live, eat, drink, and breathe. The epidemic of cardiovascular disease has so badly plagued America that more than 1 in every 3 people died because of it.
This problem here in America is the worst in the world.
Prevention and treatment were so poorly understood that most Americans accepted early death from heart disease as unavoidable. Even the President of United States and World War II hero Roosevelt had succumbed to the national epidemic of cardiovascular disease. In 1948, a group of special scientists started one of the largest and longest running epidemiological studies. The scientists followed over 5,200 people in Framingham for many years. Some families even joined, and this made the study even more interesting. They wanted to find out what things could make people's hearts not work well. The study told us some very important things about staying healthy. They found out that things like smoking, having high blood pressure, eating unhealthy foods, and not moving around enough could make our hearts not work well. They call these things risk factors because they could be risky for our hearts. This study also helped us understand that how we act and feel can affect our hearts. For example, they talked about something called a type A personality, which means being stressed or always in a hurry. They learned that being too stressed can be tough on our hearts. As people learned more about what the Framingham Heart Study found, they started to make better choices. They decided to quit smoking, eat healthier foods, and exercise more. This made a difference in keeping their hearts healthy. What they did, following a group of people for a certain duration, is known as a cohort study. A cohort study is like keeping track of a group of friends over a long time to see how their lives change. Imagine you have a group of friends from your town and you want to learn about how they stay healthy as they get older. So you decide to follow them and take notes about their lives. You find out what they like to eat, if they exercise, if they smoke, and many other things. Then you keep watching and taking notes for many years. As the years go by, you can see if some of your friends start to have health problems like heart issues or diabetes. By looking at all the notes you have taken, you might figure out that some things like eating healthy food and not smoking can help people stay healthy. That's what a cohort study is like. It's a way to learn and watch from a group of people over a period of time to understand how their choices and habits can affect their health. It's a kind of like being a detective, trying to find out what makes people stay healthy or get sick. To do this, we use some special numbers and math. One important number is called relative risk, RR. It tells us if doing something like eating healthy makes a big difference in staying healthy. If the relative risk is 1, it means both groups are equally likely to get sick. If it's more than 1, it means one group is more likely to get sick. And if it's less than 1, it means one group is less likely to get sick compared to other. Attributable risk, AR. Attributable risk helps us understand how many cases of a disease can be attributed to doing a certain thing. For example, how many cases of lung cancer can be attributed to smoking? It tells us extra risk that comes from doing that thing. So, if the AR for smoking and lung cancer is 10%, it means that 10% of the people who got lung cancer can be linked to smoking. Population attributable risk (PAR). Population attributable risk is like attributable risk but on a bigger scale. It tells us how many cases of disease in a whole group of people are because of doing a certain thing. Let's say the PAR for smoking and lung cancer in a city is 20%. It means that 20% of the cases of lung cancer in that city can be linked to smoking. Population attributable risk helps us understand how much we can reduce the number of people getting sick if we can get everyone to stop doing that thing. These numbers help scientists and doctors figure out how things like smoking, unhealthy food, and lack of exercise can affect our health. They also help us make decisions to stay healthy and avoid things that can make us sick. Cohort studies have been instrumental in advancing our knowledge of health and social issues, helping researchers and policymakers to make informed decisions to improve public health and well-being.